Okay, well we're in Three Shires Hospital this afternoon. I've got Tina here with me, who's previously had 2 caesarean sections, has had a lot of split with the actual abdominal muscles, came to see Mr. Richards 6 weeks ago and decided to go ahead and have a tummy tuck, abdominoplasty. And we're in Three Shires just prior to surgery now, so we thought we'd let everybody have a little discussion. Tina was very interested in the procedure because she's watched a lot of our videos online and was quite keen for people to see her tummy and have the procedure videoed. So Tina, why did you come to Aurora and Mr. Richards?
I'd looked around at different places and a friend put me on to Aurora, and then I researched a lot of Mr. Richardson's work and I thought, you guys are the best bit for me really.
Yeah. Now obviously the tummy has been a bit of an issue. How old are your children now?
My eldest is 7, the youngest is 3.
Okay. And you had both caesareans, so you've got 2 scars if I remember.
That's right, yeah. The first caesarean, after the first caesarean, went back to smaller than I was, with no bulge, no nothing.
Yeah.
So the damage I think was caused on the second pregnancy.
Yeah. So did you get much bigger?
I got a lot bigger very quickly.
Yeah. And was she a bigger baby the second baby?
No, she wasn't. It was just, they reckon that the muscles might have been open a bit to start.
Yeah.
And that's why my pregnancy was so big and
so
uncomfortable.
Yeah. Yeah. Okay, obviously, you know, you're 3 years on post-baby and you do quite a bit of exercise and diet. Your diet is very good now as well, isn't it? Yeah,
I've tried to be as active as I can be, but with this abdominal separation, it's very hard to do, like sit-ups, anything that involves weights. It's made me quite a weak person.
Yeah.
So trying to keep my weight at a steady, you know, it has been very hard.
Yeah. Do you have any back problems or anything?
I do, yes. I found my back has arched a lot, which I've gone and had physio for, but with no good result.
Because quite often if the core muscles are weak, you don't get the stability the same, the support for the back, you see. Now Tina has quite an interesting tummy, so we're actually going to show you her tummy prior to the surgery, because when she puts it in different positions you can actually see areas bulging. So we're just going to take her gown off. So Mr. Richards has already been in, consented Tina and marked the area. Now we do ask all our patients if they wear specific underwear or they like to have a scar that's going to potentially be hidden with their underwear to wear them. So Tina's put her underwear on today that she tends to wear, that you want the scar to be hidden under. So we've literally marked the scars under there. So if you can actually position your tummy, darling, so that we can see that area bulge. So if you can actually see, we've got a whole area here where Mr. Richards has actually marked where the muscles actually are split.
It's more of a, you can see
and you can see it very much from there. So
it's hard to, but it's sometimes, there it is there.
Yeah, could definitely see that.
That's quite dramatic actually, isn't it? And if it's somebody that's actually very petite, and probably a lot of people will say, I don't know why. Yeah, so the aim of the tummy tuck really is to give Tina a much better appearance with her abdomen. Obviously, any stretch marks that are above the tummy button will still be there, but they will be much lower towards the scar area. But the big thing for her is to get rid of that bulge and to strengthen her back really as well. Okay, how are you feeling?
I feel fine. It's been a long wait, so I'm glad I'm here.
Yeah,
I did think I'd be really nervous, but everybody's been really nice here and kept me up to date, so I'm fine.
So you've had
a nice sleep.
You've had a nice sleep, a nice rest. And we'll be taking you down to theatre probably in the next 40 minutes.
Lovely.
Alright, obviously when Tina wakes up from the anaesthetic, she will be what they call in a jackknife position, so her head will be slightly elevated, but so will her knees. So the actual scar itself will be in that position. So she'll have no stretch on the scar. Our patients also have catheters put in theatre, so it's just something they don't have to worry about post-surgery. And she'll have a really comfortable night, so we don't do very much post-surgery tonight, but tomorrow will be very different for her.